Welcome to Surviving Schizophrenia with Steven. My name is Steven. I hope you're having a wonderful day. I've had schizophrenia for 13 years now, and I have been on the same medication for the last 10 years. And actually, I think just this last week, there was a new medication approved by the FDA that treats schizophrenia. And I'm actually considering maybe making a change now, because lately my quality of life has not been that great. And who knows, maybe a new medication or other treatment might actually help with my schizophrenia, and it may also help with my quality of life and hopefully getting rid of all this fatigue I feel and my other symptoms.
Right. So, Stephen, welcome back to Surviving Schizophrenia. I'm Steve, Stephen's dad. Stephen and I had a long discussion yesterday about this. There's exciting news here in the United States. The Food and Drug Administration has approved a new medication, a new antipsychotic medication for the treatment of schizophrenia. It's been many years since we've seen a new medication to treat schizophrenia. And of course, antipsychotic medications are the conventional first line of treatment for schizophrenia. That doesn't mean they're the only treatment, but it's been the conventional wisdom that this is the first line of treatment. So we had a long discussion, Stephen, yesterday about this. We've also been discussing, the keto, medical keto, or just the keto diet, and how that might play into any decision you make.
Yeah.
So with the new medication that the FDA has now approved for use with schizophrenia, and with all this talk about medical keto that is has shown some promise of relieving some symptoms of schizophrenia, what are your thoughts about this?
Yeah, so the medication I'm on has been working. I have not had psychosis for a decade now. No serious schizophrenia symptoms per se. However,
The positive symptoms.
I should say positive symptoms.
Right, which are the hallucinations and delusions. There was one slight issue you had a few months ago.
Yes.
But aside from that, yes, we have not seen. Stephen has had no psychosis. I think we can just say that straight out.
Yeah.
That Stephen has had no psychosis for about 9 or 10 years. Fell ill when he was 12. He just turned 25. So it's been a long time. He's on 2 antipsychotic medications and
one antidepressant.
And that has turned, that's proven over the course of the last 9 years to be the key to Stephen's recovery. Although what Stephen is saying here is absolutely right. He's got these negative symptoms.
Yeah, and these negative symptoms are extreme exhaustion and fatigue, mental fog, anxiety, depression.
So, Stephen, what do you think about all these new potential treatment options?
I think it's very exciting. I think it could be amazing, but I'm also very hesitant and scared to try anything new. Because I don't have psychosis right now. I don't have anything super severe that needs to be addressed necessarily, like if it were psychosis. So I'm hesitant to change what's working, even if that one thing that I change it to could make it way better. But it is exciting to think that maybe if there's a new treatment or something I could do that could alleviate my other symptoms of, like, maybe help with my depression, my anxiety, and my extreme exhaustion and fatigue, I think that would be amazing. And I think I'm finally in a place now where I'm considering actually doing this, because for a long time I just thought, nope, I'm not changing anything like ever. I'll be on this medication for life and it'll be good. But I'm realizing now, if there is something new that I could try that would work, just how much better my life could be.
Right. So we'll discuss this. Of course, Stephen will with his psychiatrist.
Definitely.
And take her recommendation on best course of action, and we're likely to get a second opinion as well from another psychiatrist and consult other resources to get, to try to move forward, because Stephen's making a great point. He's made great strides with his schizophrenia that, but how can we get to the next level, right? How can we improve Stephen's quality of life? And can these new medications or new approaches like with keto improve Stephen's quality of life? And, what Stephen is talking about here is that since he's been so stable.
That's the right word, stable. Thank you.
Go ahead.
Yeah, I've been so stable. I don't want to mess with that. It's like, I don't know what it's like. I don't want to risk any kind of backslide, right? Where I might fall back into psychosis or have serious issues. That's something I have to protect, like, my brain at all costs. And changing to something different and say going off my medication to whatever new treatment or medication that I would try. The fear is that if that doesn't work, what would happen? Right. Would I fall back into psychosis? Would there be more serious issues for me? I don't know.
Right. So I think these are very legitimate concerns. The approach that one might take and that we're taking, would be different depending upon the situation. So if this was an onset of schizophrenia, we might be taking a different approach than we had taken before. We're now 13 years in, and the medication that Stephen's been on has been very effective. Mm-hmm. So, and prior, in that first 3 years, we tried a number of different antipsychotics medications that did not significantly reduce the psychosis. No. And we found the right mix here that has eliminated psychosis and reduced some of the negative symptoms. So, we're in a different position than, and maybe are taking different measures than someone might take or a doctor might recommend if the person had just fallen ill with schizophrenia. Yeah. So I think that's important.
If I had just fallen ill and I was taking care of me, sounds weird, but yeah, I'd be trying a lot more things to see what works, right? And if there was this new treatment, I'd probably be recommending that I would try that because maybe that'll work better. But in the situation I'm here with now, it's like, it's been working. I've done that phase already. Do I change or do I not?
Right. So in talking about this yesterday, one of the things that we discussed, Stephen, was that, with the new medication for the treatment of schizophrenia that was just this week approved by the Food and Drug Administration in the United States for use with schizophrenia, is proven in clinical trials to be very effective in treating the positive symptoms and to be somewhat effective also in ameliorating the negative symptoms of the illness. But, we're really not going to know for some time after this is broadly used in society, what the real implications are of this medication. So is it prudent for Stephen to, switch quickly to this new medication?
I don't think it is. If something's very new, it takes time to fully realize. I don't want to be one of the first people to take it, say in case a year down the line, more and more people have taken it and all of a sudden there's an issue that they didn't know about before because it hasn't been out long enough.
Right. It makes sense. I mean, if this was... So, Ken, we haven't even discussed this with Stephen's psychiatrist. No. These are just...
I will. But, yes.
Yeah, right, exactly. I mean, these are just issues that are, hitting us now.
Yeah. And
that we're discussing. And Stephen wanted to shoot a video to just lay this out, how we're dealing with all this. The other thing is there are, the new medication is still an antipsychotic medication. So it treats, it impacts the brain a slightly different mechanism of action than other antipsychotics have, medications have. But then this also leads to, what about diet? And should you try the keto medical diet, which you don't have to go all the way keto medical, but maybe you should do some employ the medical keto diet. Is that something, Stephen, that you've considered, and what are your thoughts on that?
Yes, I have considered it. I mean, sure, it very well could help. I don't know. But I am kind of adverse to it for me personally for a few reasons. One, food is like one of the simple things in life that I just enjoy. And limiting that would limit my enjoyment of food, which then limit my enjoyment of my life in a lot of ways. I know you have to also monitor that very carefully. And I don't know if I'm in a place where I can do that. Not to mention, I don't understand how if, say I go somewhere, right, for whatever reason, and they don't have the right kind of food that I have to eat for that diet, but I'm already on that diet, and if I ate something that I'm not supposed to eat because I had to, would that be negatively impacting my mental health? If that makes sense. Like, I don't know if I'm up for that.
Right. There's been a lot of research in this area on the ketogenic diet and whether that can alleviate symptoms of schizophrenia and psychosis. So there's at this point there's anecdotal evidence and some studies suggesting that it would alleviate some of the symptoms of schizophrenia, but there's no definitive evidence, at least that I know of, that would suggest that it can cure schizophrenia, or that someone like Stephen with childhood onset, treatment-resistant schizophrenia can be cured if he went onto a medical keto, diet for life. I guess that would be essentially for life, and went off all medication. So,
which also is the thing I'm scared of doing as well. Like I mentioned earlier, it's like I'm hesitant to go off my medication. That scares me. And so keto diet or new medication, whatever it is, going off the medication I'm on currently really does scare me.
Right. We're not negative on keto by any means.
No.
It
really could help. I am not sure. It's just like any kind of change of my treatment, it's scary.
Right. I mean, it certainly has helped some people. And so this is a very personal decision, obviously. Yes. It should only be made with, between the person that has the illness and their care providers and their doctors and other healthcare professionals and dietitians that can, see them through this process.
Yeah.
And would require a lot of support.
Yeah.
So, these are very interesting topics of potential new treatments or new thoughts about how to treat schizophrenia. Yeah. It's super exciting for us. Gosh, I mean, I would love. I get excited about it because I know Stephen's quality of life is not there.
To get more understanding of that, like, I sleep a good 12 hours every night. I wake up at 11 a.m. in the morning, drag myself, I say 11 a.m. Sometimes it takes me longer even then to get out of bed. Drag myself out of bed, go do my morning routine. That takes me like an hour. Notice that. It shouldn't take an hour to brush my teeth and stuff, but it does. And I'm still exhausted throughout the end, fatigued throughout the day, have brain fog, not able to focus too well. It makes it hard to record these videos, especially lately. The last few months have been extra hard, and it's been hard to record even videos, which I was doing not that long ago, actually, like one a week, and it's not happening now. I feel like in a way my quality of life is declining a little, and that's really why I'm considering, like, maybe I should try a new way of treating my schizophrenia. I mean, it's still scary, but I'm really considering it now.
The conventional thought and the conventional treatment thought on schizophrenia is, first line is antipsychotic medications, then psychoeducation or cognitive behavioral therapy, and then also education about the illness, support from care providers, family members, and then diet also. So that's kind of the conventional wisdom on the treatment of schizophrenia. But things change, and that's great. It's really exciting what might lie ahead in the future. I mean, Stephen is very young. Oh, go ahead.
Yeah, in that vein, it's like I kind of thought this is me thinking, right? New treatments for schizophrenia were a very long way off. I used to think, because there haven't been new treatments for how long?
It's been a long time.
Yeah. So I kind of thought this was way further off than it actually is. And now with these new ways to treat schizophrenia, it's exciting. Even if I don't actually do anything with these ways to treat it now, the fact that there are new treatments coming faster than even I thought, who knows, maybe we'll be closer to more treatments coming out as well.
Obviously, and Stephen would love to see a return to, and a remission of schizophrenia, a return to where he was prior.
Which, I know, even if I were cured tomorrow, though, and I go back to doing things I did before, there's still two issues. One, I've missed out on a ton of life experiences. I fell when I was 12 years old, so I missed high school, really, like a normal high school experience. I missed a lot. That's a whole different kind of anxiety to be expected to go back.
Right, that's PTSD, basically.
That's where I was going for, yeah.
Right. Post-traumatic stress disorder, and certainly if there were a medication to put, or a diet, right, to put Stephen's schizophrenia in remission completely, one, that'd be awesome.
Yes, and we're not just here for that'd be phenomenal.
And we would do that, and we will look, and keep you informed of what's on this channel, what Stephen's doing. But of course, what Stephen's saying, the PTSD, that the anxiety and stress of what's happened in the last 13 years, which is now more than half of the time Stephen has been on this earth, that just doesn't go away.
No, and also how do I interact with people my age when I have missed so much, right? I don't know how I would even do any of that.
Well, hopefully if schizophrenia were in full remission, then that would be not a non-issue, and that you would maybe just you'd get back into life.
That sounds.
Does that sound?
That sounds almost too good. You might be right. I just think there'd be some. I'd probably if we're in full remission, it probably wouldn't be that big a deal. But I think initially it'd be culture shock. Not culture shock. It's complete.
You'd be in shock.
Yeah. Culture shock's not the right word, but no. I would be in shock.
Yeah, you would. I mean, you would. And it's been a long journey, and we thank you for joining. Stephen, on this journey.
Sorry, I'm getting a little tired.
Yeah.
Yes, definitely. Thank you for watching these videos. I don't think I said this video, but doing this channel and getting all the amazing support from you has helped. With the last 3 years, really helped me recover too. I was not doing as well as even I am right now, which I'm not doing as good as I was the last couple months, as I was before I started this channel. This has helped so much, and will continue to help me so much through my whole life, really. It's given me confidence, it's given me confidence mainly. And
pride in what you're doing.
Yeah, it's
and a reason to live, maybe.
I was about to say it, actually. It has given me a reason to live and to continue on, even through the hard times. So thank you. The
last little piece, obviously, here is that one can flip flop back and forth, and that can be kind of, I guess, a rabbit hole that we don't want to go down. We have to be.
I've never done that, actually. And I think it's worked very well for me. Even when I was in the darkest of times and in psychosis, I always knew I needed to take my medication. I think I've only missed taking my medication like one night, maybe two. And when that's happened, I've taken it immediately in the morning. I've never gone off my meds and had to go back on them and off and on or anything like that.
Right, but if the other angle, the other thought here though is say you tried medical keto, okay, and that might involve probably about a year to do that, right, and or 6 months at least. You did that under the care of psychiatrists, dietitians, and then went off your meds, and then in 6 or 7 or 8 months after that, maybe a year, psychosis comes back, you have issues, then you flip maybe to this new medication. Okay, so that doesn't work. You go off that. You need to go back on antipsychotics. Maybe you're on antipsychotics plus medical keto. I don't know. I mean, then you've got so many complications here, and then maybe then you go back to a regular diet where you're not on the keto medical regime, and you try this new medication that was just approved this week by the FDA in the United States. And then maybe that doesn't work. You try that for 6 or 7 months. That's another year. So you're 2 years out, and you're flip flopping around, and the quality of life has dropped significantly. And now you're trying to get back to where you were 2 years earlier. And that is the main that's kind of the elephant in the room, so to speak, in the situation we find ourselves in.
It's actually the best way to put it, and also a reason why I am scared.
Yeah. But we can't be scared of, I mean, I'm saying this for myself too. I mean, we really need to look at all these avenues and see whether, one of these approaches in a broad population is effective. Then I think that's when we might consider, making the move. And of course, that's going to be between Steve and his psychiatrist.
Of course, but I do agree that is when I make the move, probably, because in this case progress could be good, and so if I stick with the old and never go for the new, I'll never get further than I am right now. Those are risks with doing that,
right?
Of course.
Right, and those risks are worth taking if they're prudent at the time.
Yep.
So
yes.
So I think that's kind of lays out where we're coming from and how we view this. Of course, this is just our views on this. You've got to obviously it's going to be up to the psychiatrist and dietitians and therapists to ultimately decide what and with their care providers and the person with schizophrenia what course that person will stick with too, and that's
That is so true. If something's not gonna last, like if, for example, I needed to go on a diet of some kind, but no, that's not the right way to put it. But like, if it's not gonna last, it might not be worth trying, in my opinion, for me, right? Because if I can't do it for long enough for it to continue to work, I might not want to start it in the first place.
Yeah, that's a good point. We're kind of continuing with this video. That's great. I mean, it's one of the reasons that I read about this new antipsychotic medication that was just approved by the FDA. One of the reasons that it looks so promising for people on other antipsychotic medications is that many people fall off the medication. They're only on it for a few months. Their symptoms, or their positive symptoms of psychosis, retreat, and they go away after a few months, or they have negative, so then they discontinue the medication and then it comes back, or there's so many side effects to the medication that they stop taking it.
Yeah.
So that's one of the promising features of this new medication. Fewer side effects and very good efficacy on the positive symptoms and some on the negative. So, but that's, if you're not able to continue the course of treatment, then that would be a significant factor to consider before you start the treatment.
Yeah, That goes for literally everything, I think.
Right.
Any kind of medication or treatment for anything. Like, it has to be sustainable. Otherwise, it doesn't really work in the long run.
Right.
I think that's all for now. Thank you so much, especially if you made it this far into the video. Don't know how long it was, but it was pretty long, especially compared to what I usually post. But really, thank you. And we both hope you have a happy and healthy rest of your day. And we hope to see you in the next video.
Take care. Hope to see you in the next video.
Bye.
Bye-bye.